Do you know the early signs and symptoms of PCOS? This question opens up our conversation today about polycystic ovary syndrome, or PCOS as it's commonly known. This health condition affects 1 in 10 women of childbearing age, making it a prevalent issue that certainly deserves our attention. PCOS is an endocrine disorder characterized by an imbalance in female sex hormones. This imbalance can lead to irregular menstrual cycles, excessive hair growth, acne, and even fertility issues. That's why understanding its early signs and symptoms is crucial. Recognizing these signs early can provide a head start in managing this condition effectively. It's not just about treating the symptoms, but also about improving the quality of life for those affected. So, it's time to cast a spotlight on PCOS and arm ourselves with knowledge to tackle this common health issue head-on. Stay tuned as we dive deeper into the early signs and symptoms of this common health issue. So what are some of the early signs of PCOS that you should be aware of? First off, let's talk about irregular periods. This is one of the most common signs of PCOS. Women with this condition may have fewer than 9 periods a year, more than 35 days between periods, or some may have very heavy periods. Next on the list is heavy bleeding. The periods you do have can be heavier than normal. Because a woman with PCOS doesn't ovulate regularly, the uterine lining builds up for a longer period of time. So when you do get your period, the bleeding can be heavier and more painful. The third sign to watch out for is excess hair growth. Known as hirsutism, this symptom affects up to 70% of women with PCOS. This excess hair appears in areas where men usually have hair, like the face, back, and chest. It's caused by an overproduction of male hormones, which PCOS can trigger. Another common sign is acne. Breakouts can be another result of the overproduction of male hormones. Acne is often seen on the face, chest, and upper back. Weight gain is another early sign of PCOS. It's often one of the most frustrating aspects of the condition. More than half of women with PCOS will have weight gain and obesity that's difficult to manage. Other signs can include darkening of the skin, particularly along neck creases, in the groin, and underneath breasts. Skin tags are also common, which are small excess flaps of skin in the armpits or neck area. Lastly, there may be thinning hair or hair loss from the scalp, similar to male pattern baldness. It's important to remember that these signs can vary widely from person to person. If you're experiencing any of these symptoms, it's crucial to consult with a healthcare professional. Recognizing these early signs can lead to earlier diagnosis and treatment. Now that we've talked about the early signs, what are some symptoms of PCOS? Polycystic ovary syndrome, or PCOS, is a hormonal disorder common among women of reproductive age, presenting with a variety of symptoms that can significantly impact a woman's health and lifestyle. One such symptom is infertility. Women with PCOS often experience irregular menstrual cycles due to an imbalance of reproductive hormones. This hormonal imbalance can prevent the ovaries from releasing an egg, leading to difficulties in becoming pregnant. Next, we have metabolic syndrome. Around 80% of women with PCOS are overweight or obese, and these women are more likely to develop conditions associated with metabolic syndrome. These conditions include high blood pressure, high blood sugar, abnormal cholesterol or triglyceride levels, and excess body fat around the waist, which collectively increase the risk of heart disease, stroke, and type 2 diabetes. Then there's sleep apnea. This is a condition where breathing repeatedly stops and starts during sleep, often resulting in daytime fatigue. Women with PCOS are more likely to have sleep apnea, particularly if they are also overweight or obese. Mental health is another area impacted by PCOS. Women with this condition are more likely to experience depression and anxiety. The hormonal imbalances associated with PCOS can affect mood, and the physical symptoms can also contribute to feelings of distress and low self-esteem. Lastly, we have endometrial cancer. Continuous high levels of estrogen can cause the endometrium or the lining of the uterus to grow excessively, leading to a higher risk of endometrial cancer. Women with PCOS often have prolonged periods of estrogen exposure due to irregular menstrual cycles, hence their increased risk. These symptoms can have significant impacts on a woman's health, making it crucial to recognize and address them. It's important to remember that early detection and management can help control these symptoms and reduce the risk of long-term complications. So, you've identified the signs and symptoms. What can you do about it? Well, the journey to manage polycystic ovary syndrome or PCOS, can be a personal one, with remedies and precautions tailored to an individual's unique needs. That's why it's important to consult with a healthcare provider for a personalized treatment plan. Firstly, lifestyle changes can be a significant factor in managing PCOS. Regular physical activity and a balanced diet can help regulate your menstrual cycle and lower your blood sugar levels, which can reduce PCOS symptoms. It's also important to maintain a healthy weight, as weight loss can improve the body's use of insulin and balance hormone levels, both of which are key in managing PCOS. Secondly, medication may be recommended by your healthcare provider. These medications can help manage individual symptoms. For example, birth control pills can regulate menstrual cycles and reduce levels of male hormones, while metformin can improve insulin resistance, a common issue in PCOS. For those who are trying to conceive, fertility drugs may be prescribed to help stimulate ovulation, and in some cases, anti-androgen medicines may be used to block the effect of male hormones and reduce symptoms such as excess hair growth and acne. Surgical options are also available but are typically considered as a last resort. One such procedure is ovarian drilling, a laparoscopic procedure that uses heat or a laser to destroy parts of the ovaries, which can temporarily lower male hormone levels and promote ovulation. However, it's important to remember that each of these remedies come with their own risks and potential side effects, and what works for one person may not work for another. In addition to these remedies, there are also precautions you can take. Regular checkups with your healthcare provider can help monitor your symptoms and adjust your treatment plan as needed. Regular blood tests can check hormone and glucose levels, and regular ultrasounds can monitor the condition of your ovaries. Remember, while these remedies can help manage the symptoms, they are not a cure for PCOS. But with the right treatment plan, you can live a healthy and fulfilling life despite this condition. Did you know that your diet can play a huge role in managing PCOS? Yes, indeed. What we eat, how much we eat, and when we eat can all affect our body's hormonal balance, inflammation levels, and weight. In the case of PCOS, a balanced diet is not just about maintaining a healthy weight, but also about managing the symptoms and improving overall health. Let's start with the basics. A balanced diet should include a mix of macronutrients, carbohydrates, proteins, and fats. But not just any type of these. For carbohydrates, opt for whole grains like brown rice, quinoa, and oatmeal, which are high in fiber and can help regulate blood sugar levels. Avoid refined carbs like white bread and pasta, which can spike your blood sugar and exacerbate PCOS symptoms. When it comes to proteins, lean sources are your best bet. Think fish, chicken, tofu, and legumes. These proteins can help you feel full and satisfied, reducing the urge to overeat or snack on unhealthy foods. Now let's talk about fruits and vegetables. These nutrient powerhouses are packed with vitamins, minerals, and fiber. They not only add variety and color to your plate, but also help in reducing inflammation, a common issue in PCOS. And then there are fats. Yes, your body needs fats, but the right kinds. Healthy fats like those found in avocados, nuts, seeds, and olive oil can help balance hormones and manage PCOS symptoms. So don't shy away from them. What about the foods to avoid? Well, processed foods and sugary drinks are a big no-no. They can lead to weight gain, inflammation, and hormonal imbalances, all of which can aggravate PCOS. Remember, everyone is unique, and what works for one person may not work for another. It's about finding what works best for you. Always consult with a healthcare professional or a dietitian before making any drastic changes to your diet. Eating a healthy diet can help manage symptoms and improve your overall health. So let's make a promise to ourselves to eat mindfully and healthily. After all, our health is our wealth. To wrap things up, PCOS is a common health issue with various signs and symptoms. We've explored how irregular periods, excessive hair growth, and weight gain can be early indicators of this condition. Further symptoms can include acne, thinning hair, and mood changes. It's important to remember, though, that having one or two of these signs doesn't necessarily mean you have PCOS. If you notice a combination of these symptoms, consult a healthcare provider to get a proper diagnosis. We've also discussed various remedies and precautions like maintaining a healthy weight, staying active, and limiting processed foods. Incorporating a balanced diet rich in lean proteins, fruits, vegetables, and whole grains can significantly help manage PCOS symptoms. Remember, early detection is key, and a healthy lifestyle can go a long way in managing PCOS symptoms. Thank you for watching, and take care of your health.